Vitamin E is very important for your collagen buildup, and it also protects the breakdown of your collagen. So as an anti-aging, I think vitamin E is one of the most essential elements which should exist in your regime.
I would say 1 in 2 patients that come to us every day is severely deficient in vitamin D3 and B12.
True.
Today, it's 1 in 1, every patient.
I agree with
and
you.
I'm not talking about levels of, let's say the reference range is 30 to 100. Okay, I'm not talking about 25. I'm talking about 15, 14 children with 6 and 7,
Yes.
which worries me about their overall development. Forget about just their bones, their cognitive health,
Yes.
their immune system, and B12 as well.
True.
Like a normal reference range could be between 200 to 900, and they're at 200 and they're fine. And then patients come and say, but it's not been highlighted in my report. And
Yeah.
the point is you're still at the lowest range and it's falling further and further.
Yeah.
What is the correlation that you see between these low levels? Because I know you use a lot of B vitamins and vitamin D. What is the connection between vitamin D3, B vitamins with your skin, with your overall health as
True.
well?
So it's what you said, right? I think for me also, it's literally my one-on-one. Every patient I see is deficient in vitamin D or a B12 very commonly. And I think with the new diets that have come into place, we are depleting ourselves further from this B12. You need to understand that we are dependent solely for our body to receive this vitamin through our food. Our body is not manufacturing B12 on its own.
Right.
So it needs to come through our diet. So that becomes a big factor. Having said that, I already emphasized on how important your vitamin D is for your cellular proliferation, which controls the appearance of your skin, how you are regenerating in that sense. And that becomes essential for vitamin D. B12 and in fact the whole B complex is so important for your pigment cycle, for your cell regeneration, and for your hair growth. And you will be shocked to see that how many young kids with PCOD are actually showing a deficiency in a specific vitamin. So even biotin is a type of a vitamin B, right? And this whole theory came of how biotin supplements can help your hair. So having said that, we all know that these vitamins become absolutely essential for the growth of your hair follicle as well as for the skin, for the regeneration. And when we look at levels, I wish people would understand that the purpose of a level was for you to have a median value. So when the range is from 200 to 800, an optimum level for you would be a 500 or a 600.
Yes.
And that will not be highlighted in your report. But when a patient looks at it, they say, oh doctor, my level is 211. It's not highlighted. So why are you supplementing me? Which is where you need to become aware. So even when you take a supplement, it says recommended daily allowance.
Right.
That means that a certain amount should be going into your body
On a daily
every
basis.
single day.
Yeah.
And that is how you will have an optimum value. And without these optimum values, see, your skin, being your largest organ, suffers for that reason because it's also getting supplied the last, right? Your body is going to move its nutrition into areas where it seeks of high importance. Heart, brain, nerves, gut, right? Skin is where it's coming last. So if my level is already at 200, my body is going to manufacture it and send it to my nerves because my nerve health is totally dependent on my B complex. If you don't have a proper B complex, you can't have healthy nervous system. And that's not only your cognitive health, that's also your sensory perception, how your body is perceiving the heat and cold, and all of this myriad is actually controlled by a simple group of hormones and these essential minerals. So for the skin to be supplemented, you need to take these in a much higher value and they need to sit in your body at a higher value. So your vitamin D should be at a 60 for you to have a healthy skin and hair. At 6 or 7, poor thing is just going to be able to give it to your bones to make sure that your bones function.
That too not enough. Yeah.
And that too not enough. You become prone to easy fractures. Mood. Your mood gets significantly affected with low levels of vitamin D. So it's very important to have an optimum range, and that's why when you look at a value, please look at a median value. There is a reason a range is given. The purpose is to be that median value.
So that's a fantastic point. You spoke about retinol earlier. I'd love to speak about retinol, its usages today, the overuse of it, and also about the fact that there is a natural way for us to also, I'm not saying it's a replacement. Some people will need retinol. But I would love for you to educate our audience on the fact of how cellular turnover happens naturally as well, and also about retinol.
So, retinol is actually just a derivative from a vitamin A. That is what it is. And it's available for you to consume it orally as well as for you to put it topically. Now, the oral vitamin A which was given, which is a popular drug, it goes with the name of isotroin, the salt being isotretinoin. It actually helps with your cellular turnover. It's helping reset your cell turnover. Because in all diseases, including acne, your cellular turnover is what is altered. So when you use a retinol, your cells are shedding at a particular rate, which is good for your skin. So your skin is getting regenerated, and that gives you that healthy shine and glow, right? But what you need to understand is when I topically use a retinol, I'll use it only on my face. I can't lather it on my body. So if I was to consume foods and take supplements which would actually help my cell regeneration and turnover, I would be able to achieve it more holistically. Consuming a magnesium supplement can be immensely helpful for your cellular regeneration. Vitamin D, vitamin C, B complex, just these simple things. Having a diet which encourages, that is foods which are rich in these elements. But sometimes, as I said, foods cannot be enough for the amount you need in your body. We need to take an oral supplement. Just giving this oral supplement will help to set your cell turnover rate. And a normal individual cell turnover rate is anywhere between 3 to 4 weeks. So 21 to 26 days. But because of our lifestyles and the pollution and our environment, our cycles have become 45 days, 48 days. So the skin starts looking dull. See, what you do in a facial is typically that. They remove the top layers of, your exfoliation, that is all your dead skin. That's how you glow. But then why don't facials last long enough? Why do facials give you a glow only for 2 weeks? Because the dead skin buildup will happen again. So you need to reset your body from within to have that reset cycle, right? That's the only way to do it. And I feel that is the most sustainable way to do it. I'm not saying don't go feel good. I practice aesthetic medicine. Yes, once in a while you need facials. You should be using the correct creams. But I still insist on how it is important to do it holistically, because I just feel that's more long term.
Yeah, that's more sustainable for sure. I wanted to talk about vitamin E. A lot of people have started using vitamin E oil. You get this oil and they apply it on their face.
Yes.
Is that going to be absorbed into the system? And could I also eat vitamin E rich foods, or even supplement with a vitamin E for that, like you spoke about retinol?
So, Luke, I feel that vitamin E is very essential, but not for everybody. So vitamin E is a fat soluble vitamin, right? So when you consume it orally, one, you need to do it correctly. It has to be had with high fat foods, and it should be taken, let's say, cyclically. So you take it for 3 months, give a break, and then wean off it and then have it again. But why vitamin E is important is because vitamin E is very important for your collagen buildup. And it also protects the breakdown of your collagen. So as an anti-aging, I think vitamin E is one of the most essential elements which should exist in your regime. But topically, vitamin E is a very sticky oil, right? And it's working more of an occlusive. So it's trapping the moisture and making it stay. So if you're using a vitamin E product, it has to be used only at night in a controlled environment. I can't be applying that oil and moving around, because that's going to attract more allergens and dust to my skin. So if you use it in the right amounts, in a lower concentration, it can be beneficial.
Oh, that's a great point, because we get a lot of questions on that.
Yes. No, rosehip oil, vitamin E, primrose oil, these are all great, right? Out of which rosehip oil has shown the maximum benefits for collagen. So if you see why these things became popular for stretch marks, is because they help with collagen. So there's a very logical answer to all of it, but it's just that we don't look into it. We just say, oh, stretch marks, use this. We don't try to understand why or how is it helping. And if it's helping you by applying it topically, imagine how much it will help you if you were to consume it, right? Because topically, how much will you absorb?